Well, it's Thursday, the 2nd of December, and this is just a brief update I want to go through. The main news is that the variant, of course, has been detected. The Omicron variant has been detected in the United States, as we said it would be. Just surprising that it's taken as long, to be quite honest, to detect it. Now, I want to do a video report from South Africa on one of the first patients to have suffered from the Omicron infection. We'll do that in a minute. We've also got a medical report from Australia, but just a quick brief update as to where we are. It's still morning, actually, on Thursday the 2nd of December. So Omicron is now in 24 countries, and so far the World Health Organization have said that the cases are mild so far. Now, in a sense, we'd expect them to be mild so far because people tend to get iller in the second and third week after the infection. There is a slightly concerning, it's more than an anecdote. There is an increase in the amount of younger people and children admitted to hospital in South Africa, but we really don't know enough about that yet to say this is Omicron related. It may not be, because of course there's other infections can occur as well as Omicron, SARS coronavirus 2. But let's have a quick look where we are. So now in 24 countries, I think about 56 countries have now imposed travel bans. Now, Omicron is now the dominant variant in South Africa. So the three things we were concerned about, of course, was how quickly this would spread, how much immune escape there would be from people that had the infection and people that have had the vaccine, and thirdly, how sick does it make people. Now, we're still not sure about the last two. It's looking like it doesn't make people that sick so far, although we really are quite anxious about this, because if people are going to get sick, it'll be today and tomorrow and the next few days where they do start to get sick. So we're really watching this really closely to see if people are getting sick, and we're watching it really closely to see if younger people are getting sick as well. They're my main two anxieties at the moment. I remain optimistic about both, and we're pretty sure there is going to be some immune escape, but we can say for certain now, well, I think pretty well we can say for certain that we are getting massively increased transmissibility with this variant. So this is so we're less than 4 weeks in the South Africa situation, and the Omicron's becoming dominant in South Africa. National Institutes for Communicable Disease in South Africa, South Africa's National Institute for Communicable Disease, NICD, they're saying last month, and of course this is now a month behind, that 74% of all genomes sequenced last month were Omicron. And we do know that they do try and take a representative sample, so we can say that just within a few weeks of Omicron emerging, it accounted for 74% of the cases in South Africa. Therefore, in South Africa, it has already replaced Delta, essentially. Or there's only, what, 26% of Delta left. And now, when we're looking back in a month's time at this month, I suspect it's going to be much higher than that. It's gone from nothing to 74% in a few weeks. This is massively outcompeting Delta, no question about that now, really. And this means that Omicron will, I can't see any way that it will become the main variant in the world. So you and I are going to be exposed to this if the spread throughout the world is anything that's like it has been in South Africa, and there's no reason to assume it won't be. It's a biological characteristic of the virus. Now, first case in the United States, California, yesterday, Wednesday, the 1st of December. The individual, we don't know, male, female, age, know nothing about them, unfortunately. Travelled from South Africa on the 22nd of November. So this is actually a while back now. Mild symptoms started on the 25th. Now, what we don't know is what the heck they were doing in that time period, in that interim period. Were they out and about? Were they out partying? Were they sitting at home on their own? I'm afraid we have no information on that at all, because that's going to be a critical time period. Mild symptoms, which are now improving. They weren't hospitalized. They're in isolation now, but we don't know about the past. Aggressive contact tracing is underway by the CDC, as you would expect. But of course, there's been thousands of people arrived on flights from South and Southern Africa. This is just the one that happens to have been picked up. And really, it is a bit of an indictment in the States that their genomic analysis is so poor, really. Well, no other way to describe it. Compared to Europe, it's poor. Person was fully vaccinated, but then again, they had very mild symptoms. That had 2 doses of Moderna, but they were in the 6-month window, so they hadn't been boosted. So in other words, it was less than 6 months since their second dose of Moderna. So that tells us there's immune escape in terms of symptomatic infection. Of course, as we would have thought, as we already know, we've basically ticked the immune escape box and we've ticked the massively contagion box. We're just hoping we put a nice big firm cross in the makes people sick box. Close contacts have tested negative. That's remarkably encouraging and somewhat surprising given it's the way it spread throughout South Africa. The close contacts of this individual in California so far are testing negative, so that is good. Could it be there's a longer incubation period? Well, that's not impossible. That's not impossible. Again, we simply don't know that. Dr. Fauci is promoting vaccinations now in the States, with 60 million people in this country who are not vaccinated or eligible to be vaccinated. Let's get them vaccinated, direct quote from Dr. Fauci. Let's get the children vaccinated, get boosted now. We may not need a variant specific boost. Well, that's just as well, because we're not going to get one until March or April or May, so there you go. So that's what Dr. Fauci is saying. I leave that to you to consider. European Union, of course, Dr. Ursula von der Leyen yesterday was saying that we might need to consider mandatory vaccination in Europe. A lot of comeback on you from that, as you would expect. European Union vaccine rollout for 5 to 11-year-olds is brought forward by a week or 2 weeks, I'm not sure, but to the 13th of December. Now, having said get boosted, and Dr. Fauci here saying get boosted now, Mike from the World Health Organization, Dr. Mike Ryan, of course, says there's no evidence that I'm aware of. That will suggest that boosting the entire population is going to necessarily provide any greater protection for otherwise healthy individuals against hospitalizations or deaths. So there you go. You can take the opinion of the experts, or you can take the opinion of the experts. Take your pick which expert you would like to take your views from. To be fair, the reason that Dr. Ryan is saying this is he wants to get lots and lots of shots all around the world, which of course that would seem to make sense. But definite divergence of opinion there, I think. Decide whether you want to listen to your own authorities, the medical authorities in the UK, Chris Whitty, Patrick Vallance, of course, massively in favour of vaccination, President Biden, Boris Johnson, massively in favour of vaccination, Mike Ryan from the World Health Organization questioning that. So there you go. Dissent from Mike Ryan, who of course is, I can't remember what he is, he's one of the seniors in the World Health Organization anyway. World Health Organization, coronavirus will keep producing new variants as long as it is allowed to circulate freely in the unvaccinated countries. So Dr. Ryan there clearly saying that variants are more likely to arise in people that are unvaccinated. But there is counter-argument to that, of course, because in people that are vaccinated, you are more likely to get immune escape variants being developed, because a virus that will survive in a person that's vaccinated by definition is one that is not going to be affected by the antibodies and the immune response produced to that specific vaccine. That's one of the concerns about if we had a specific vaccine for the Omicron variant, that it could give rise to other immune escape variants to other viruses. United States, you must have a negative test now to fly into the United States within 24 hours. That's quite a big change. Now I want to play the videos now. So we've got videos from Australia, and we've got videos from one of the first people to suffer from Omicron variant in South Africa. So do stay tuned for those bang up to date stuff, and thank you for watching.